eczema. Eczema is the most common inflammatory skin disease. The National Institutes of Health estimates that 15 million people in the United States have some form of eczema. Eczema is characterized by various types of skin lesions, including erythema, papules, vesicles or blisters, erosion, oozing, scaling, magnification, cracks, and usually itching. So this is some forms of eczema. And eczema may look different from person to person, and many substances have been identified as eczema triggers. Okay, from shampoo to urine, from food to water, and from environmental, factors and to some emotional problems. And the triggers, it's difficult to identify it. This is hand eczema, and also this is hand eczema. The conventional Western medicine, treatment includes skin creams. The skin creams just control swelling and allergic reactions. Mostly the doctor prescribed corticosteroids, antibiotics to treat secondary infections, and histamines, tar products, light therapy, and moisturizer. Now, in traditional Chinese medicine, we think eczema can be caused by both internal and external factors. Damp heat is the main cause of eczema. Now, what's cause dampness? The constitutional weakness and dysfunction of the transformation and transportation functions of the spleen result in the accumulation of damp heat on the skin. The acute stage is due to the dysfunction of the heart, and the subacute and chronic stage are due to spleen and liver dysfunction. Dampness is the main pathogenesis in the acute stage. But when the disease transitions to the chronic stage, the accumulation of damp heat usually combined with insufficiency, blood deficiency, and blood stasis. So, in chronic stage, insufficiency, blood deficiency, blood stasis are very common pattern. So, this is a young person who has an itch condition primarily distributed on the inner elbow area. You will be interested to know that the skin lesions are also behind the knees. This is a type of eczema where itchy dry skin, we call it atopic dermatitis. This is the most common type of eczema. It affects a lot of different people and appears in their specific pattern. So, mostly, this is a condition with dry, inflamed, and itchy skin that appears in a specific pattern. It usually appears in childhood and is often linked to asthma. The specific gene has not been identified, but we certainly know that when both parents have atopic dermatitis, 81% of their children will develop it. So that's why we think there is a genetic predisposition for this disease. And some environment factors make this genetic disease worse. We know heat makes it worse. Water exposure, not drinking water, makes it worse. Soap makes it worse. Strep bacteria and staph bacteria make it worse. This knowledge helps us to design our treatment plan to treat this disease. We cannot change the genetics, but we can change the environment. Now, let us go back to the 9-year-old young boy who suffered from atopic dermatitis for 4 years. He presented with red macules and papules all over his body, especially on his face, neck, trunk, flexor and extensor surface of his knees, elbows, hands, legs, and feet. Around the ankles, the skin lesions were thickened and cracked with a serum-like discharge. They were extremely itching and painful. He also had asthma, but his parents had no history of eczema and asthma. He was prescribed with steroids creams externally and histamines, prednisone, and antibiotics internally, and an inhaler for his asthma. After taking prednisone, his skin lesions were better, but whenever he stopped taking prednisone, the skin lesion flared up right away. In traditional Chinese medicine, the symptom identification was blood dryness with dampness, so he was prescribed with some herbs with functions to nourish blood and transform damp. After 1 month, there was big change. This picture was taken after he was treated for 5 months. Now, this is a picture of psoriasis. According to the National Institutes of Health, as many as 7.5 million Americans have psoriasis. There are 5 forms of psoriasis, including plaque psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis, and erythrodermic psoriasis. Now, we know plaque psoriasis is the most common type of psoriasis. About 80% of people who develop psoriasis have this type, which is characterized by very thick plaque with several scales, primarily on the extensor surface of the skin. Now, this picture, it also shows the same kind of several scales. This is also psoriasis, only in a wider spread form. This is also psoriasis. What is psoriasis? It is nothing more than fast-growing skin. We know normal skin takes 28 days from its creation to slough off. However, in some patients with psoriasis, the skin only takes 3 days to mature. The mature cells come up to the skin surface very quickly and begin to slough off. Psoriasis also affects the nails and the scalp, and it is interestingly also associated with arthritis. About 10 to 30% of people with psoriasis also develop psoriatic arthritis, which cause pain, stiffness, and swelling in and around the joints. And also, 1/3 of patients with psoriasis have family members with psoriasis. If one twin has psoriasis and another twin has a 65%, the chances of developing psoriasis. So we know the specific gene have not been identified for psoriasis, but there seems to be a genetic link. We know psoriasis can last a long time, even a lifetime. Symptoms come and go. Things that can make psoriasis worse include, infections. We know infection will make it worse, okay? And trauma makes it worse. Stress makes it worse. Dry skin makes it worse. Certain medications make it worse. For example, even some psoriasis medication make it worse. We know insulin, when people use too much insulin, and that will cause flare up. The conventional Western medicine treatment includes topical treatment, phototherapy, and systemic treatment. So the topical treatment, including corticosteroids cream, and some cream made from vitamin 3 and some ointments containing retinoids, coal tar, ethylene, and salicylic acid. So the phototherapy, that means it's treatment with light. For the systemic treatment, this treatment, adjusted for severe case. And some of these medications suppress the immune system. And this medication also cause significant side effects. And nowadays, biologics are also very popular. It includes amivantamab, Raptive, and embryo. So all of them are immunosuppressive and also cause severe side infection. Now, in traditional Chinese medicine, the causal basis of psoriasis is pre-existing deficiency at the nutritive and blood level that provokes wind and dryness. So the skin loses its nourishment, and that's why the thick and dry several scales result. Now, this patient is a 47 years old male with nearly a 20-year history of thick plaques with several scales on the scalp, trunk, hips, legs, and arms. There was no joint pain, but mild pattern of the nails. The skin lesions were only mildly itching. He had no remissions during his period. No family member has psoriasis. He has been prescribed with steroid creams, but with very little effect. In traditional Chinese medicine, the syndrome identification was blood heat with blood stimulation. So he was prescribed herbs with the functions to clear heat and move blood. After 2 weeks, there was big change. This picture was taken after he had been treated for 3 months. Now, can I believe we talk about dermatology? We did not talk acne. So, acne is a disorder of the skin's sebaceous glands that result in plaque spores and lesions, which present with blackheads, whiteheads, inflamed papules, pustules, cysts, and nodules. Acne occurs on face as well as neck, chest, back, shoulder, and upper arms. Although most teenagers get some form of acne, adults in their 20s, 30s, 40s, or even older can develop acne. Acne is a serious health threat, but it can be disfiguring and upsetting to the patient. It may leave permanent scars. Nearly 17 million people in the United States have acne, and it is one of the most common skin diseases in the USA. Acne medication reduces the clumping of cells in the follicles and oil production, and diminishes bacterial and inflammation. In conventional Western medicine, topical medicine includes topical creams, gels, or lotions with vitamin A acid-like drugs, benzoyl peroxide, or antibiotics. So the oral medication include antibiotics, birth control pills, tretinoin or isotretinoin, corticosteroids, and anti-androgenic drugs. In traditional Chinese medicine, heat is nearly always involved in the etiology of acne. Wound heat, damp heat in the intestines and stomach, or heat in the blood, which appears in severe acne. Strong emotions also result in stimulated heat and then result in acne. This is a 21-year-old female who presented with papules on the cheeks and pustules on the cheeks, forehead, and chin for more than 2 years. The skin lesions were worse before her period. She was prescribed with oral antibiotics and sulfur ointment, which did not help. She didn't want to take birth control pills. In traditional Chinese medicine, the syndrome identification was blood heat, so she was prescribed with herbs with the function to clear heat. Thus, this picture was taken after getting treatment for 6 weeks. Now, of the wide variety of skin disorders, eczema, psoriasis, and acne are just a small aspect in the dermatology. In traditional Chinese medicine, syndrome identification is the most important. In dermatology, each disease we have different treatment principle, and personal patient is treated differently. Not one treatment for each disease. So, if you have any question, just send me email. Have a good night.